Hello, I'm Fraser Ratchford with Canada Health InfoWay. I'm pleased to present to you a webinar on patient access to health information, which was conducted as part of our ImagineNation Outcomes Challenge. The Outcomes Challenge seeks to accelerate the growth and spread of key technologies in 4 categories. To learn more about the challenge, please visit the challenge website. In the Patient Access to Health Information category, Cancer Care Ontario's DAP-EPS was the first place recipient of our Trailblazer Award. During this webinar, they will share their experience implementing and adopting their solution and will lead a discussion with others. We hope this is helpful to you. To start things off, we will play a short video created by CCO for the challenge, and then CCO's presentation will follow.
The reason why I'm involved in this is because my mom's got lung cancer. To keep in communication and make sure that we're on track with her appointments and her medication and things like this, I have access anywhere I go. As long as I have computer capabilities, then I'm able to access this information and keep up and say, hey, you know what, remember you've got an appointment coming up, Mom, you know, are you ready for it? Have you got everything that you need for that? Being in a doctor's office, they see a lot of people during the day. And if you're not prepared with the questions and you're on the ball, you may miss something. And then you leave and it's like, oh, you know, I missed that question or I forgot to ask that, and you don't have that opportunity. Now it's right there in front of you. You've had the appointment, there's some results up there, you know where she's going next, you know what's up and coming, and it's just better support system than going to your regular doctor. Not that they don't care and that would not, you know, we're not getting good information. It's just in a different style. It's easier to understand. Anybody can do it. My mom's 71. She's never touched a computer before. Now she's doing it like a pro. Oh, I checked it out this morning, honey, and she was on there and doing it great. So if she can do it, anybody can. Having played with it for a little while and understanding the basic concepts is really easy. The general public's going to have a fantastic time using this. Anybody will be able to access it, gain knowledge, understand what's supposed to happen next, and it's their whole process through these stages is not going to be so scary for them anymore. This is going to be a phenomenal program. And as it adapts, as it evolves, it's only going to get better. It's just the ease and the comfort knowing that I know what's going on and I can explain it well to my mom, and now she's getting more involved. When you're more involved, you have that information and knowledge, you don't feel so isolated with your illness. Cancer's big and scary. Now that the information is more accessible, it's easier to understand. It's easier to be more in control. When you're in control, you have a better success rate. I don't care who you are, information's power, and you need that power to succeed in your treatment.
So without further ado, I'd like to turn this presentation over to Cancer Care Ontario. There's multiple speakers, so I'll let each of them introduce themselves, and we'll start with their presentation. Do you want people to ask you questions as you're going through, or do you want to save it to the end?
It's a short slide deck, so whatever anyone comes with, feel free to interrupt, but won't take more than 10 minutes.
Okay.
Yeah.
All right. Great.
So I'm Melissa Kahn. I'm the manager for Diagnostic Assessment Programs at CCO.
Oh, I'm Erin Ray. I'm a project manager implementing the DAP-EPS to our sites across the province.
And on the line, John, are you there?
Yes, I'm John Kimball. I'm project manager for development of the DAP-EPS tool.
Great. So just as a quick overview, I'm not too sure how many of you on the phone are familiar with Cancer Care Ontario, but we're a provincial agency overseeing the delivery of cancer services across the province of Ontario. That includes everything from screening and prevention of cancer all the way to palliative phase and survivorship of cancer. And the Diagnostic Assessment Program, which I oversee, is meant to help with the diagnostic phase of the cancer journey. So primarily managing patients from when they suspect that they have cancer to the time where they're diagnosed or shortly thereafter after their first treatment may occur. And these programs were developed over the last 4 to 6 years across the province. We started out in lung cancer diagnosis and have been slowly moving into colorectal and prostate, as well as breast. And these programs live outside of the cancer programs in a way that they're not physically in the cancer center, so they don't have access to the same IT tools that many of the cancer centers do. You know, these programs are meant to help manage patients with all the diagnostic tests that they have and all the consultations that occur during the time of their diagnosis. And there's a nurse navigator there to help facilitate their care and provide psychosocial support and symptom management to them. And they're really there to help manage their wait times. But they need the electronic tools to help support all their work because they have all these different tests and appointments that are trying to be coordinated. And so the CCO, Cancer Care Ontario, has an incredibly strong CIO division, and they develop a number of tools which help support the work and service delivery of cancer services across the province. And one of the pieces of work that was developed was the DAP-EPS, also known as the Diagnostic Assessment Program Electronic Pathway Solution, which is quite a mouthful, but it's what's working for us right now. And so with this tool, really was meant to help fill the gap in terms for DAP staff to help manage their patients. So we took it a step further and made it accessible for patients and providers as well. So I will now pass it on to Erin and John, who will talk to you a little bit more about what the DAP-EPS is.
Thanks, Melissa. So that's a good background, and this first slide here pretty much just reiterates what Melissa said. So far, the DAP-EPS is a joint initiative between Cancer Care Ontario, the Canadian Cancer Society, and Canada Health Infoway. We've piloted it at 2 sites so far, Waterloo Wellington Regional Cancer Program and the Regional Cancer Care Northwest, and this is in both lung and colorectal cancers. We're rolling out into 2 new sites this month, so we're going to the Southeast Cancer Program and the Hamilton, Niagara, Haldimand, and Brant cancer region as well. So there are 2 separate websites for the DAP-EPS. There's a patient portal and a provider portal with separate web addresses as well. The tool is interactive. It is built upon the clinically validated disease pathways. This is kind of the foundation for the tool, and it has really provided the clinical groundwork for this, and then we expanded it over to the patient side as well so that they could follow along as the clinician does. it is designed to increase workflow efficiencies on the provider side, and as we've been talking about, it does empower the patient as they progress through their diagnostic journey to give them that information that they need. A quick summary of the benefits, and we'll go through for each different side. So for the patients, they are able to get real-time information about their diagnostic process. They can get a timeline of their journey. So this provides them with a schedule of their upcoming appointments, the location, the time, the provider. It also provides them any information that they need to know about that appointment. And this information is coming from the Canadian Cancer Society. So if they're going for a CT scan, there will be information populated there about what a CT scan is, what they can expect to find when they go to the appointment, and things like that. Friends can also invite friends and family members to follow along as well. So the family member would get their own username and password and would be able to log in and follow and see exactly what the patient does. And they have access to what we're calling their care team. So any providers that are involved with the patient's care will be automatically populated into their care team. And the patient can see this, the family members and friends can see this as well. And they're able to print out this care team list with all their contact information, should they choose. But regardless, they have it all in one place. For healthcare providers, they have the access to the clinical pathways that we've talked about. And it enables streamlining of the diagnostic scheduling process and the coordination of testing. This supports the provider in identifying when a patient should be referred to the DAP. So this, again, links back to the clinical pathways and the diagnostic maps for this. But really, the healthcare providers, as the nurse navigator role that Melissa was speaking of, is key for the EPS because they are really able to improve their workflow through the use of the tool. It is more efficient. They can see all the scheduling information in one place. And we also have results notification in place currently. For the healthcare system as a whole, it reduces duplication and system waste. We are using the tool to help measure and manage the wait times throughout the diagnostic process. And it does facilitate communication between different clinicians and hopefully lead to faster diagnosis for patients. We have included a few testimonials from some of our users to date, which you can read through at your leisure, but the feedback has been good so far, which is why we've moved from the pilot phase into what we're calling phase 2, and this includes the rollout of the 2 new regions, and we're going to an additional 2 regions come the fall. So that's it in a nutshell. John, did you have anything to add before we open it up for questions?
No, that sounds like it.
Great.
Well, thank you very much. This is an exciting initiative that you guys have taken under, and so I'll open up the floor to questions, but because I'm sort of moderating, I get the first crack at the first question. So how did you get clinicians to say, we're on board with this, we actually think this is a good idea for our patients to have access to this information? So we often hear where people who are considering this move and who want to implement this type of solution has, their reluctance is, our clinicians don't think we want to do this. So what did you guys have to do to actually convince your clinicians to adopt this solution?
I mean, I think that's a really great question, Fraser. I mean, it's really a big lesson in change management, really, with clinicians. I mean, certainly the clinicians were philosophically in agreement with sharing information with patients. Certainly, patients have access to this information now if they want it, if they were to go through the effort of asking them, paying for it, and having them printed off. But we're taking that middleman out and making it more accessible for patients. I think it's really trying to focus on the fact that we're trying to deliver patient-centered care and making it easier for the patients during this time. I mean, it's, going through a cancer diagnosis is a time where patients are filled with stress and anxiety. There's a lot of uncertainty. Any time that you can give the patient more control, better understanding, I think is to their benefit, and physicians recognize that. Certainly also including them in the discussion and the decision-making was critical in the deployment of this.
And if I could just add something to that too, the intent here too is to improve the workflow for the clinician and the clinician staff. So by providing the patients with this information, hopefully it will reduce the number of phone calls they're getting, about simple things like I've forgotten what time my appointment is or where my appointment is. So the information is now in an accessible place for the patient, and will hopefully reduce some of that clerical piece from the clinician staff point of view.
Great. I think we had a question. Jennifer, did you have a question?
I did. Thanks, Fraser. And thanks for the presentation. I was wondering if you could talk a little bit. You've obviously got a range of different types of both tools and information available to patients. What's been most popular? What have you found that people have really been interested in looking at? And what maybe you thought was a good idea at the time, but you're getting less traction on at the moment?
Let me take that one?
Sure.
So from the tool that we have today, the most popular thing is the scheduling. It's the where am I supposed to go next. So when a patient first logs in, on their dashboard, we actually built in the upper left-hand corner a little mesh. We call it News Flash. It says, your next appointment is here with this doctor. He's doing this. Here's his phone number. Because that's sort of the thing they wanted to know next. The most common thing they're forgetting is where am I going next? What's the next step of the journey? So just providing that sort of basic scheduling data, it prevents a phone call to the DAP, and it prevents a little bit of anxiety on the patient side. Now they always know what's coming up next. What has not had a lot of traction was the patient journaling feature. We put a feature in to allow patients to download their appointment list and print them and write sort of their own notes about what happened at the appointment and sort of keep a log of what was going on, with the intention that if they did wind up having cancer, they could bring that sort of logbook with them and go into treatment, sort of knowing what's happened in the past and prepare for the future. It hasn't been that popular. I don't know if it's because it didn't integrate it properly, we're not selling it enough, or because they're only in diagnosis for such a short amount of time. But the sort of grand dream there was sort of almost like a social media type thing where they could log on and talk to people and chat, and it really hasn't panned out that way. So the whole idea of a patient maintaining a journal or even electronic paper format really hasn't been realized yet.
Thanks.
Are there people on the line that have been considering implementing such a solution or that have had or implemented a solution that they sort of have some comments to add to CCO's experience?
I know I'd love to hear from some of the other projects, how they went about trying to gain clinical buy-in and support from the administrators and the staff who are actually seeing the patients day to day and implementing a solution where we're sharing results with them.
How did you get clinicians? You got clinicians, but how did you get the patients to actually say, yes, this is what we want as well?
Well, we have, this was something that we were hearing more broadly, but we're actually in the process of trying to include more patients in advisory committees at CCO. Certainly there is a patient family advisory committee that exists at CCO, but we're trying to include them into the steering committees for this tool itself. But the feedback that we've been getting through the patient family advisory committee has helped lead us down this path. Also, Sunnybrook's MyChart, they share information with patients, and it's been very well received, and we knew that this is the direction that we should be moving towards with this tool.
I like in your video that you actually show that it's a family member accessing the system, and so how does that work? So how does the whole registration work, and how does it work with other family members also being part of that sort of care team?
the process is quite simple from the patient's perspective. They can give out what we are calling a family code. And so they give the code to the family member, and then the family member goes in, enters their own secure password, has their own username, and what their view is the exact same as the patient. So we're sure to tell patients when they are, going to include other family members that if they're going to be viewing this, they'll be viewing the whole thing. So there's information you don't want to share. Probably don't invite the family member. But it's a very simple sign-up process, just like any other logging in. So you have secure questions. So if you forget your password, there are 3 secure questions that you have your own secret answers to, and you go through the signing up your unique password.
Again, just a quick comment. It was important for the design of the family and friend feature that it's entirely patient-driven. You don't have to ask your doctor for permission to give a family code to somebody. As a patient, you control who can see your account.
Oh, that's good. Okay.
Fraser, I have a question.
Yes.
It's Bhavna here, and my apologies. I missed the video, and I was a bit late calling in. But I want to congratulate you on this initiative. I think it's very important, and ironically, recently I've had friends who've been diagnosed with cancer, and I know they'd find something like this very useful. The question I had was, and again, I'm sorry if I missed it, was how many patients and providers are actually engaged with using this tool at this current time?
I think our most recent numbers, which are not that recent, are about just under 200 combined.
Okay.
Users and for physicians and patients and family members. So keeping in mind we were only piloting this in those 2 sites for the 2 cancer types, lung and colorectal, for now. So we're expecting that to grow quite a bit with the addition of these 2 new sites and then another additional 2 come the fall. We do have some lofty targets that we're hoping to meet by the end of this year in terms of getting physicians and patients on board with the tool. And along with that, we're looking at how to capture patient and provider feedback. The way we're developing this tool is in an agile process so that we do updates and new feature requests every 6 weeks. So our intent is to make the tool as patient-friendly as possible, while at the same time we can make changes on the provider side to make it as useful to them for their purposes.
Thank you. And do you have any plans to roll it out with other types of cancer, such as breast cancer?
Yes, we do have current plans to be rolling it out for breast cancer at this time. That's something that we're looking at within the next 1 to 2 years.
Okay.
Hopefully earlier than that, if possible. And expanding beyond into other cancer types as well as the DAP program grows, so into prostate, possibly into with gynecological cancers such as cervical and so on.
Thank you.
Yeah.
The tool is designed to be scalable. So from a technical standpoint, John can back me up on this, I'm sure, it's very feasible for us to expand into different cancer types and possibly even in the future into different phases of the cancer journey as well.
Okay, Jennifer, you have another question.
I do. I'm wondering if, because there's obviously a lot of interest in this phase of the process in this type of tool, whether it's in cancer or elsewhere, if you were starting again and somebody was just fresh, what advice would you give them?
In terms of developing a tool that's patient-facing, or developing a tool exactly like ours, if we were to start over again and use hindsight to...
Well, actually, it's funny, Jennifer, that you asked that question, because mine was quite going to be similar. It's like, what would you do the same and what would you do differently? And so from that, if there's people on the call right now that want to implement some sort of tool that's very similar, what advice do you have for them?
John, do you want to take that one?
Yeah, let me start with that. Let's go back to sort of the beginning and how we wound up here in the first place. I think our method was pretty good. I wouldn't change the methodology we used. It might have a very different result if we were to do it again today. CCO is very much a research-driven organization. We do lots of research into drug effectiveness and cancer methods and cancer pathways. We're really big research shop. And so the research we had was that we know that patients going through the diagnostic assessment do go to the internet, they search Dr. Google, they search WebMD, they talk to their friends, they talk to their families, they do sort of have this real thirst for knowledge. And so what we did was we looked around and we first did a sort of a review of all the portals and all the stuff we could find. We said, well, where can we tell our patients to go to get the knowledge they're looking for rather than hunting for it by hand? The problem with hunting for it on Google is they get too much information, and the vast majority does not apply to them specifically. You're only going to have 4 or 5 tests to determine if you have cancer or not. But if you Google cancer test, you'll get hundreds of results back. And so they're just drowning information that's not relevant to them. And so we went out and we did a review. We went to various partners and said, where can we get this information for our patients? How can we steer them in the right direction? And nobody really had a patient-specific, patient down to the patient level website or portal or even application or tool yet. People were working on various bits and pieces, but no one had really pulled it all together. And so we had sort of 2 design philosophies. One was the tool would stay in. When you're at a patient, you log in the tool, it's all on one screen. You never leave the screen you're on. It doesn't open up new windows, doesn't open up pop-ups, it doesn't send you somewhere else. Everything is contained in one spot. And the second thing we have is what we call filter the noise, where we want to take out all the noise of the Internet and just show you what's relevant to you. And so to do that, we had to open up data service agreements with the Ministry of Health to get OLS data. We had to open up an agreement with eHealth Ontario to get various pathology data. We had to sign deals with the local cancer centers and the hospitals to send us their data to sort of build this picture of you're a patient, here's your individual tests that matter to you for this part of your cancer journey. And forget about the rest of it. This is what you need to know for your individual journey. I think that method of looking around to see what's out there, determining what your needs are, and if the needs don't exist, then you have to create it yourself. It's still a good method. Now, that was sort of 3 years ago. If we did that same method today, maybe this tool does exist somewhere else. Maybe the patient can go get it somewhere. I don't know. We haven't done it. We'll do it again this summer, another review of it. But I think the first thing to do is see if it already exists. There are a lot of portals out there. There's our review of the Northwest region, which is the Thunder Bay area. It's 21 portals that providers and patients can use. 21 different websites, 21 different passwords. So surely one of those is the one you're looking for that can help you find the information you need. So, our basic method was review the landscape in Ontario, see what's available, compare it to what you think you need to do to lower patient anxiety and to improve access to patient care, and if none of them does it, then you're sort of forced to do it yourself. So we didn't have plans to write this tool from scratch originally. We really wanted to sort of buy off the shelf tool and say, here you go. But there wasn't one available in 2009, so we wanted to write it ourselves from scratch. So I think that method's pretty good. Whether you get the same result we did is a different question.
Thanks very much.
So taking that one step further, John, is there anything, now that you have the hindsight, is there anything that you'd do differently?
Yes, there's a couple things we did differently. We had taken basically, when we reviewed with certain part organizations what they have available for us to deliver for us, we'd taken their delivery dates with sort of, okay, that's what we're going to do. And then it turns out now that 3 years later they haven't done stuff they promised us to do in sort of 2010. So I would be a little less optimistic on if you're going to cobble together a solution from various different partners. They tend to be very optimistic on what they can get done on their time frames. So I would try to put a little, take a little bit of salt when someone says, oh, we'll have a full EHR next year. Okay, let's see your plan for that. Go a little bit deeper into, rather than accepting what they tell you at the front, I'll go a little bit deeper and say, okay, give me your project plan and maybe even your timeline, how far along on you are. Our research was a little bit too light. We went to the partner organizations, we said, what are you going to do next year? And they gave us all these great things they're going to do. But we didn't actually dig deep enough to see if they're actually capable of delivering those things or not. So not to be I don't want to be cynical, but you got to go a little bit deeper than we did and say, okay, you said you're going to have single sign-on available this fall. What are you going to take? What steps are you going to be doing to make sure that happens? And am I going to be the first person using this? Am I the only person asking for it? Who else is driving you to make single sign-on available? And if they've got 10 people waiting in line to use it, you're just one of the 10, then that's great. But if you're the only one asking for it and nobody else knows about it, there's less chance of actually happening. So we need a little more detail on each of the pieces we wanted to use for the tool.
John, I think that's a really good point. You know, it becomes difficult when we're dependent on other organizations and when other electronic tool developments. But certainly one of the things that makes the DAP-EPS powerful is that we are well integrated with what assets are available across the province, that we strongly align ourselves and try to meet provincial standards and national standards wherever possible. Because, you know, as John also mentioned, there are so many tools out there. If you're not working with other people and integrating your solution, you're going to be the one who falls behind, because you can't be the one standing alone. The DAP-EPS works well because we're integrating with the hospitals, we're integrating with provincial agencies, and I think that's one of what makes the information and powerful and what will help drive it forward.
Wow. Thinking about sort of that future vision then and integration, and as more and more of these portals sort of exist, do you see yourself sort of hooking in behind some of them, in front of them? Or, I mean, cancer is such a unique topic on its own, but from the patient's point of view, you know, where do I go? Do I go to my hospital portal? Do I go to my physician's EMR? Or how are you, again, integrating, and how do you see yourself sort of fitting in with all of these ones as they sort of implement? Because most people are probably behind you right now, but some could end up leaping ahead just by virtue of now they're starting now and they learned all your information. So.
Exactly. It would be a lot easier to write the EPS tool today than it was when we started 3 years ago. Yeah. Just because even the technology tools are better, websites are richer, and development tools are easily available, and so, yeah, we could be leapfrogged. So, but to answer your question, we actually, the web front end of our tool, where you actually go and log in and look at stuff, that's kind of optional. We built the tool actually as a service that gathers data from these various places, as I mentioned, from the ministry and from eHealth and from the hospitals. And then we are the first customer of those services. So when you log into our website, the website actually goes and asks and says, okay, give me that patient's calendar, give me that patient's results, give me that patient's demographic information, and give me where they are on the pathway. Other websites that want to ask those questions of us can. So we can be a back-end tool. If someone does have a patient portal, they can ask us, can you please give me the patient schedule for their diagnostic journey? And we'll say, okay, here you go. And then they can format it and put it any way they like on their website. So that's the advantage of using a standard. Like we use what's called a web portal standard to do that. So we can be queried and asked and embedded into anybody's portal as long as they just open the portal up and ask the questions of us. Our actual front-end website is more of a sample of what you could do with the data we have, as opposed to a final destination of how it should look in the end. So when they get around to making a single patient EHR, we're ready to take questions and give data back to them in any format that they want.
Wow, that's great.
Yeah.
Well, I'd like to thank Melissa, Aaron, and John for a great presentation and for sharing with us your experiences and your product direction as well. So you guys have done a great job. Before I sort of let you go, though, and we also have some housekeeping issues to deal with specifically on the challenge, what has the challenge made you guys do differently?
Well, let me start with my end of it. So I'm the development guy, and so like I said, you know, my job is sort of to find out where the data is and go and get it, and then at the last step we throw it up on the website. Our focus has really been on sort of heads down building the tool. And so what the challenge sort of woke us up to say was, you know, we need to really start focus more. The tool's pretty good. Focus more on the adoption and focus more on the deployment. We've got to get out there now and sort of set what we want. Our minimum standard is this tool being sent out. So we started to get reports on looking at how many patients are enrolling. If 100 patients come through the DAP, how many actually log into our tool? Is it half? Is it all of them? Is it 3/4? And so we really turned our focus towards, okay, we built this great thing, and we built it, you know, for the DAP to manage the patients, but the patient side of it, the patient portal of it, that's something how we weren't leveraged as much as we could have. And so it really woke us up to say, we have this great resource, let's drive it out there and get it more used. And that's kind of why Erin, who's sitting there with you, she was hired to be specifically the PM for deployment and adoption, to go and take that thing and run with it, where I'm saying sort of in the back end, building the tool and making it better, but she's so the front-facing part of it. So it changed their focus from being a DAP management tool to a patient-side tool.
Erin, can you maybe expand on that a little bit? You did allude to it a little bit in the body of the presentation, but I'm just interested to hear if you have any other examples of some of the activities that you've done to sort of encourage that both clinical and patient adoption. Laura, speaking from InfoWay for those on the phone. From the clinical perspective, the clinician staff, so the DAP staff, I'm working very closely with especially our two new sites to get hands-on training with them, going on site, making sure that they feel supported and they really have a good understanding of the tool so that we can find the value for them and match it directly to their workflow. So we go in, I shadow the nurse navigators in their work, and then we find out some pain points and where the tool can actually help them in their workflow. From the physician point of view, we're not really pushing that too strongly at this point until we've got some additional features built into the tool that will add value to them. So currently, results notification date is available, and in the future we'll actually have results. So we don't want to use up our opportunity with physicians too soon. You know, we understand that that's probably, we should wait until the right time for that, although we do have some physicians who are currently using it in our pilot sites. And for patients, we really do rely a lot on the nurse navigators to be providing them with the information. So again, it's giving them the knowledge and the tools they need, whether it's, giving them some marketing materials. We do have some stuff available to them, or just, helping them to find ways that we can reach the patient. And again, this is something that we're working on as we move forward. We want to make sure we get patient feedback directly too, to find out why they are or are not using the tool. So that's something that we're investigating going forward.
And do you see that then a patient's family physician also using the tool then somewhat? Or?
Absolutely. They're certainly one of the user groups that we're targeting for using the DAP-EPS. Because the DAP program picks up patients from referral from primary care provider, and they manage all the patient's diagnostic testing and consults in between before they go off to the cancer center. If it's positive diagnosis, are referred back to the primary care physician's office. Certainly, primary care providers would be invested and interested in being able to follow along their patient's journey, even from a distance, electronically through the tool. And then also be able to go back, tap into the tool when the patient's referred back to them so that they can see everything that happened to their patient during the course of their DAP care.
And would that be up to the patient then to sort of give them that as part of that family process, team care, or how would that work?
The primary care provider is part of the care team. Okay. And so upon enrollment into the DAP, there's the referring physician, which could be a primary care provider or a specialist, and so both the referring physician and the primary care provider become part of the care team automatically.
Okay. Great. Well, again, thank you, all three of you, for such a great presentation, and it sounds like you're doing great things.
That's the end of this webinar. Thanks for joining us. You can get more detail about InfoWay's Imagination Outcomes Challenge at our website. The challenge runs until March 2013, and it's not too late to register. Remember, the sooner you join, the better your chances. Have a great day.